In 2025, the American Medical Association released 3 new Level II HCPCS codes for caregiver training services. They are G0541, G0542, and G0543. Now, G0541 and G0542 is when you are doing caregiver training to one or more caregivers of the same patient, whereby G0543 is you're doing caregiver training to at least 2 caregivers of 2 different patients. So for example, you've got 2 patients, Mark and Michelle. Mark has his wife Amy with him. Michelle has her daughter Grace with her. You're doing caregiver training to Mark and Grace. So 2 caregivers of 2 different patients. That would be G0543, and that code is untimed. Doesn't matter how much time you spend doing the caregiver training, you're just going to charge 1 unit of G0543 to each patient, whereby G0541 is the initial 30 minutes of caregiver training services done that day by that discipline to 1 or more caregivers of the same patient. And G0542 is each additional 15 minutes of caregiver training services done that day to 1 or more caregivers of the same patient. Now, in all 3 of these codes, it states without patient present, which means as you're doing the caregiver training, the patient is not present. They're not there. So in the clinic setting, you're in one part of the clinic with the caregiver, the patient is somewhere else. If you're seeing them in their home as an outpatient, maybe you and the caregiver are in the family room, the patient's in the kitchen. They're just not there. Now, with these 3 codes, you are teaching the caregiver or caregivers how to do the task for the patient. So the key word is do the task for the patient. So a couple of examples. Maybe you got a patient with lymphedema. You're teaching their caregiver how to do the compression bandaging for that left upper extremity. Or the patient has, wounds. You're teaching the caregiver how to do the wound dressing changes. How to cleanse the wound, put the ointment back on, bandage the wounds. Now, these 3 codes are payable by the Medicare program, and because the Medicare program pays, we are seeing other insurances in 2025 also pay for these codes. Now, under the Medicare program, if you bill any of those 3 codes to Medicare, the allowed amount does count towards the annual therapy dollar threshold. However, the multiple procedure payment reduction, MPPR, does not apply. Also, in order to do the caregiver training services, it must be provided to an adult caregiver who is providing unpaid assistance to their loved one. So again, if the state is paying the caregiver or the family is paying the caregiver, you cannot bill these caregiver training services codes to an insurance company. Must be an unpaid caregiver. Also, either the patient or their legal representative must give consent to receive the caregiver training services. This consent can be verbal from either the patient or the legal representative, and this consent must be documented in the therapy medical record. So again, these codes are available. You may remember last year in 2024, we also had 3 new codes come out, 97550, 97551, and 97552 for caregiver training services. And you might say, well, Rick, what's the difference between the 3 CPT codes that came out in 2024 and the 3 Level II HCPCS codes that came out in 2025? With the 3 CPT codes that came out in 2024, you were teaching the caregiver how to assist the patient with various tasks. Whereby with the 3 Level II HCPCS codes that came out in 2025, you were teaching the caregiver how to do the task for the patient. For much more detailed information on the Caregiver Training Services CPT codes, be sure to click the link below.